All right, so how do you actually improve your vision? Is there a way that we can enhance our eyesight and see the world around us in a better, clearer way? Most eye doctors, including myself for a long time, would probably have told you that no, there is no way that we can do this beyond traditional glasses, contact lenses, or some form of refractive surgery like LASIK. Well, I used to think that, and it's not entirely wrong, but there's a lot of components to our eyesight and our vision that is beyond glasses and contacts and just being able to read further down the vision chart. I'm talking about things like contrast, being able to detect subtle differences between colors, between white and black backgrounds, your ability to not be bothered by glare or those bright headlights or just how bright the computer screen can sometimes be. These are all components of our vision, as well as our ability to focus from one distance to another and be able to adjust back and forth easily and comfortably. And so these are always big questions I get of how do we improve our eyesight in some way, and is there any evidence behind this? Hi, I'm Dr. Joseph Allen. I'm a board-certified doctor of optometry, and welcome to the Dr. Eye Health podcast. Today, we're going to be diving into really sharing evidence behind how to improve our vision, where the science is at. We're going to be covering three major areas that's in the research and very popular on social media right now. One of which is that of nutritional supplementation and how research is showing that certain supplements and foodstuffs can enhance the function of the retina in the back of the eye, not only to protect against eye disease, but even change and enhance our vision in many ways. We'll also talk about red light therapy, also known as low-level light therapy or photobiomodulation. There's a lot of kind of podcasts guests across the globe that are talking about red light and how this could improve or enhance vision in some ways. And we're going to demystify some of this and break down where that research is and isn't. And then we'll talk about some vision training programs. A lot of people ask me about eye exercises, or is there any sort of training program for their eyes to enhance or improve their eyesight? And well, there are some programs, and there's in fact one right now that's been winning awards because of the research that's coming out for even helping people who have eye conditions and are maybe limited by their glasses or contacts prescription, and they're showing improvement in their ability to read the vision chart using this brain cognitive kind of training program. So it's not just training the eyes to see better, you're training your brain to cognitively see better. So fascinating topics, and I'm excited to hear with us today. So first, just as we're starting off, I want to call out that this episode is being recorded not only for an audio podcast, if you choose to listen on any of our podcasting platforms, but also this is showing on YouTube with some visuals, as well as kind of breaking down the various studies we're going to be reviewing, including references. And of course, as always, something I value as a creator and as a doctor is being evidence-based and always being very transparent about where the research is and isn't. So if you ever want to read any of these studies yourself, you want to do the research and dig in, we do make the references available. And check the show notes below because we'll include a link to all of the references to everything that we're discussing here today. Now, sharing information here on Dr. Eye Health is in addition to and is outside of my patient care and clinical practice. And to help fund this mission, to help deliver the highest level of eye health education and making it free for all, we do work with sponsors. And a trusted partner of the Dr. Eye Health podcast is that of Macular Health. Now, all the sections that we talk about here today, including the sections on diet and eye health supplementation, are editorially independent. But if you are interested in what eye vitamins I personally take and trust, then you can save 20% off all Macular Health products by using our code ALLENSUMMER. That is my last name, Allen, A-L-L-E-N, Summer, at checkout, or just by simply clicking the link in the show notes. Now, we will talk more about Macular Health later, but for now, let's dive into the education about how we can scientifically actually improve vision. All right, so let's start off talking about red light therapy, also known as low-level light therapy or photobiomodulation therapy. I want to start with this one because there's a lot of interest, not only in the eye care space, but even on social channels. We have a lot of guests on podcasts, whether that be the Huberman podcast. There's also Diary of a CEO. I've seen other doctors and researchers talk about red light therapy on those podcasts before. And sometimes they're often saying or claiming that their vision can be improved in some way. And it always frustrates me as somebody who's read the research that they're not really explaining to what capacity vision is improving. And I want to demystify and be very clear about what we know and who it's going to help and like kind of what people could expect if they're going to be trying some form of red light therapy or ask their doctor about it. So just to understand, first, red light therapy, we use it for many different parts in medicine now. The reason why we're looking at red light and near infrared light, these are longer wavelengths of light, is because they do penetrate deeper into our skin and tissues, including the ocular tissues, versus shorter wavelengths of light, like blue light only penetrates about maybe 1 millimeter into the skin, which is why it's used a bit more effectively for like microorganisms like bacteria that rest on the surface of the skin. We don't entirely know exactly why red light or near infrared light therapy is working, but we do know that it affects the mitochondria within the cell. And maybe you've heard of mitochondria being the powerhouse of the cell. They generate adenosine triphosphate or ATP. And as we get older, we tend to see this component of the mitochondria not function as well. It tends to decrease, like a power plant in your neighborhood that it just isn't outputting the same amount of electricity over the course of its lifespan. And so while people who are being treated with specific dosages of red and near infrared and various wavelengths of light, they're seeing an increase in the capacity or production of ATP, along with some other changes to protein development or gene expression from the nucleus, which we call retrograde signaling. So there is some evidence and mechanisms that are coming out in the research, although I will disclose they still don't fully understand the exact capacities, but they are getting some more theories coming out, as this has in fact been researched and studied since the 1960s. So the first study I wanted to highlight comes from Glenn Jeffrey and some other researchers in his group. Glenn Jeffrey gets a lot of attention. I hope at some point to bring him on as a guest onto the podcast to kind of break down some of his research and his thoughts into red light or photobiomodulation therapy. But this is a study that came out last year and I thought was fascinating and I think is a great way to at least introduce what is going on and why eye doctors and researchers are getting excited kind of about this. So they did a study where they tested both people outside with direct sunlight exposure. They investigated whether these long wavelengths of light of sunlight, especially near infrared light, around 850 nanometers of light, and they wanted to see how it affected not only the human body, but specifically influencing visual function. So they did a kind of two-component research study where they had some people outside and they had kind of a box that they created to allow sunlight to only shine through the thorax, like through the upper body. And they measured how much intensity and what wavelengths of sunlight are coming directly from the sun overhead. But then they put another sensor on the other side of the body to see what wavelengths of light passed through the body completely. Again, like holding your hand over a bright light bulb, you can see some of that light coming through. And what they found were that the wavelengths of kind of the 600 nanometers up to about 900 nanometers, which is the red to near infrared light zone, those wavelengths pass through the body. And that means that those wavelengths don't just stop when they hit the skin, they go deeper and transmit all the way through. They also had another part of the study where they had people use 850 nanometer light bulbs, and they shined that onto the back for about 15 minutes. And the component where they checked vision is beforehand, and then about 24 hours later, after they did this like 15-minute light exposure, they tested their color contrast sensitivity. So they did an eye test where they could measure, hey, how well could you detect the differences between blue and yellow, red and green, and they were able to measure how accurate they were or how sensitive that testing was. And again, they did this before and then about 24 hours after. They also had a subgroup where they wrapped their heads in tin foil to block out exposure of this light from getting directly to the eyes. Because they're testing, hey, if we shine this light directly on the body, like on the back, will this affect the eyes in some way? Kind of a crazy thought, right? Because usually we think, oh, well, let's do a direct treatment to that specific organ. But what they found is that using this 850 nanometer light, this is near infrared light, only for 15 minutes, within 24 hours, the protan thresholds, this is red and green, being able to detect red and green light, it improved by about 9%. For people with tritan, this is blue and yellow colors, the threshold sensitivity improved by 16% off of just a 15-minute snapshot of this light. And even for the people who had their eyes completely shielded, their tritan thresholds improved by about 7%, which suggests that at least this near-infrared exposure of light could improve visual function through some sort of mediated systemic effect, not just directly retinal exposure of light to the eyeball. And this is kind of fascinating. We don't have an exact understanding of like what or why this would happen. There's some ideas that either the red light kind of bounces or refracts and kind of scatters throughout the whole body and eventually finds its way up to the eye, or perhaps it changes some sort of inflammatory mechanism like altering cytokines throughout the body. Kind of how we know when you eat different foods, your gut microbiome changes, and this will influence cytokines and inflammatory proteins that spread throughout the whole body. Perhaps this near-infrared light is creating another similar kind of anti-inflammatory effect that affects distant organ tissues. So there's different ideas of why this is happening, but it is kind of fascinating just to see that there's some evidence that, wow, the eyes are affected by light hitting even the back. Another kind of interesting takeaway from this study was that they showed that even through clothing, that this near-infrared light still is able to have this effect on the body. I will call out that a lot of these studies, especially in red light, are small sample sizes. So this study only had 40 participants in it. And again, they only measured for short-term changes only. This is within a day. And again, the exact mechanism is unclear, but really quite fascinating, right? So that kind of tickles our curiosities in a way. Now, this study was done a few years before that. This was in 2021. Also, Glenn Jeffrey was involved with some other researchers. This one studied specifically just red light. So they didn't use near-infrared light. It wasn't sunlight. It was using a lamp that had 670 nanometers of light, and they shined it directly onto the eyes. Now, what they studied was a 3-minute exposure of this light on people of ages 34 to 70. So these are older individuals, kind of getting into their middle age and beyond. And they did a single morning exposure of this light, and they found significant improved, again, color contrast sensitivity, measured 3 hours later. The blue-yellow contrast sensitivity, again, improved by about 17%, and the red-green improved by about 12% in their contrast sensitivity. So their ability to, again, discern between subtle color changes improved. So kind of fascinating, especially for people as we get older. Again, we suspect that the mitochondria in the eye and throughout the body is just the cellular mitochondria is not functioning as well, especially as we get older. But this improvement was seen across all age groups, especially more effective for people who are older. So once you start getting above the age of 40, getting into the 50s, 60s and above, then people had more consistent results in having this improvement. I did want to note some interesting findings. They noted that people who had the light exposure in the afternoon did not see the same benefits as the people who had the exposure in the morning. They still don't fully understand why that would be. It could be because there's a pattern shift with retinal physiology that we don't fully understand, or perhaps there's a change in photoreceptor bleaching throughout the day. So they're looking into that, but really kind of interesting of how that happened. They did note that these improvements lasted throughout a week. So a single treatment with this light, like in the morning, if they tested a week later, they still showed improvements in this color contrast sensitivity versus the controls. So this at least gives us some kind of, I guess, excitement that even with single individual off treatments, there is this longer lasting effect from having this type of light therapy. And it improves retinal function in some way. So kind of fascinating that, they're not seeing improvements in their eyesight or ability to read further down the vision chart, but a component of their eyesight did get enhanced. Now, where I think a lot of eye doctors are getting even more excited about this, because if you talk to most eye doctors about these two previous studies, or they listen to those podcasts where Glenn Jeffrey's talking about these studies, a lot of eye doctors are like, yeah, but is color contrast really going to make a meaningful difference in somebody's life? Maybe if you're an artist or a painter of some kind, or you're somebody who just really appreciates seeing fine colors and looking at the green leaves on a tree, being able to detect darker greens versus lighter greens. It's a component of our vision, but is it really going to make a meaningful difference? And eye doctors, especially retina specialists, often are some of the most highly critical about any sort of new treatment or claim about visual function and vision improvement. Well, here is some studies that led to the FDA approval of a form of photobiomodulation therapy, a form of red light therapy. It includes red light, but also includes a couple different wavelengths. So let's break this down. So this is the LightSight 1 pilot study from 2018. This tested photobiomodulation therapy versus sham in 30 patients with dry age-related macular degeneration. And these individuals had reduced vision. So this is, in my mind, an intermediate stage of AMD. They have reduced vision. I have patients who have intermediate AMD and still see 20/20, but these individuals had 20/40 to 2200, so they were not seeing so hot. So they use this specific device, which comes from it's called the Velita light system, and originally from a company called Lumathera, who now has since sold in late 2024 or early 2025 to a company called Alcon here in the United States. But this device, again, this was an early study in 2018, uses not just red light, but also uses near-infrared light and also uses some yellow light. And that's why we don't refer to it as just red light therapy, we refer to it as photobiomodulation therapy. But what they did is they studied them for 9 sessions over 3 weeks. So these people got basically 3 exposures to this form of light wavelengths for about 5-minute treatment sessions, 3 times a week for 3 weeks. What they found was that an average gain of 4 letters in best corrected visual acuity immediately at months 1, and then when they remeasured again at 7. This means that they improved almost a full line of letters on the vision chart for most people, that for average. And about 50% of people who had the light treatment had improvements of more than 5 letters at even just 1 month. So within 1 month of getting this treatment, they improved a full line of letters on the vision chart, which is unheard of in the eye care field. So as soon as this came out, it was exciting just for that reason. And then they also reported improvement in contrast sensitivity, so being able to detect, and we'll talk about contrast a lot in today's education, but we'll talk, contrast is your ability to detect subtle changes in brightness, like seeing dark letters on a white background to the point of seeing, I can just barely tell the difference between these shades of gray. That's contrast sensitivity. They also showed improvement in central drusen volume and central drusen thickness. And if you've never heard of drusen before, in the eye care field, when we measure for what's called age-related macular degeneration, we often see a protein buildup in the back of the eye called drusen. And it usually looks like these mountains of built-up cellular debris, and it's usually a concerning sign for a risk of advancement in that disease. But the fact that they're showing that after these treatments, that drusen improves or goes away is like a little bit shocking. Again, we've never really seen this before with any sort of treatment and having this level of like confidence in treatment. And I know from any eye doctors who are joining in and listening, and you're hearing this, you're probably like, yeah, you've never seen like drusen just disappear within like a month or a few months of a light-based therapy. So this has been kind of shocking and alarming. Again, this uses different wavelengths of light. It uses kind of yellow wavelengths, orange, about 590 nanometers of light. It shines 660 nanometers of light, which is red light, and then 850, which is a near infrared light. And it takes about 4.5, almost 5 minutes of treatment. Amazing that this is now becoming available. Now that was the 2018 pilot study. They did another study in 2021 that came out, the LightSight 2 study, found pretty much similar findings, except they did also show significant reduction in geographic atrophy. This is a retinal, again, toward the end stage of macular degeneration. As people are losing eyesight, we tend to see a progression to where the cells in the back of the eye fully atrophy. And that's concerning because that leads to a rapid decline in vision loss. Right now, outside of this type of evidence, we've largely just had injections of some medications, and no one wants to receive an injection of medication inside the eye, right? No one likes needles toward the eye, but to reduce geographic atrophy, that's like the only other thing we have. So they showed in this study they had 20% less growth of geographic atrophy versus the sham group. So, and that was within just 10 months. The LightSight 3 study, this came out in 2021. A larger study, this had 100 patients in it versus the smaller studies that had 30, 40s. Again, they're doing 9 treatments, not just over the course of 1 month. Now they are repeating it. They're doing it like 9 sessions over the course of 1 month, over 3 to 5 weeks, and then they're repeating it every 4 months. That session, these multiple sessions every 4 months for about 2 years. And what they found ultimately is not only a safety profile, but 55% of those treated had greater than or equal to 5 letters. So again, a full line of letters had improved. Another 26% of people had 2 lines, or about 10 letter gain. And then another very small, about 5.5, almost 6% of people had 3 lines improvement. So a significant change in somebody's life, especially if they're facing vision loss from a condition like age-related macular degeneration, which are usually in people over the age of 50. Now, that is the one device that is currently FDA approved here in the United States. However, I know we have a lot of listeners and viewers from around the world. And in Europe, this is a device that's being used a little bit more often, and this is the Eyelight device. This comes from a different manufacturer, similar type of technology, and that uses both red light and yellow light. And this one is used twice a week for about a month, and then about 6 months later, they go through it again for about 3 weeks. Again, twice a week for 3 weeks. And it goes through a cycle of about 15 minutes of treatment between these yellow and red lights. Their results reported in this study at 4 months of gain or 5 or more letters post-treatment versus the sham, and about 20% of the people. And overall statistically significant improvement in drusen as well. So again, pretty similar exciting findings that they're finding that, hey, this treatment with light therapy, especially in this group of people with macular degeneration, can have improved visual acuity and improvement in even physiological changes, especially with drusen and the reduced risk of progression in that disease. So some key takeaways and findings I want to highlight here, especially around red light therapy, because again, I think honestly it gets a little bit overhyped out of context and outside of the research that, you know, this could truly improve vision. Because I think a lot of people hear that and they think, oh, I don't need to wear glasses and contacts anymore. And it's like, well, no, right now, they show that people who are older, typically over the age of 34, getting into our 40s and above, with specific treatments of red or near infrared light, color contrast has been shown to improve in short term, meaning up to like 1 week. Now, it may last longer than that. We maybe just don't have large-scale studies to really have that evidence just yet, but that's kind of the limitation. It appears, at least strictly speaking about vision improvement, that people with conditions like age-related macular degeneration could have improved visual function for some people. Again, not everybody has the same results, but that has been shown in several different studies using at least 2 different type of treatment protocols with specific devices that are now being offered by many eye clinics and eye specialists around the globe. I think if somebody has age-related macular degeneration and they're hearing this, then definitely reach out to your local eye clinic to ask them if they're familiar with this research, if they have a treatment device that's available, and if that's something that may be a great, that if you have macular degeneration, that you would be a good candidate for. I always ask your doctors if that's the best thing for you. But if you're somebody who's just, no, I have great vision, or I just want to see better, just understand if you're hearing about red light therapy, there are some limitations. Right now, it seems more like color contrast is the only thing that we truly have evidence for improving eyesight for. Hopefully that at least gives us some frame of reference of where that research is. And again, that's something I strongly value is kind of trying to break through some of the noise that we hear on social media and knowing where that truth really lies. Now let's talk about diet and supplementation, because diet and supplements is something that I've been interested in for a long time as an eye care professional. Even before I got into optometry, even as a student in undergrad, I took some nutritional courses because I've always known that, hey, I love food. I love the taste of food, as we all do, but there's clearly a difference between people who choose to eat like unhealthy foods versus healthier ones. Like where's that cutoff? Where is the science really coming from? And most of our pharmaceuticals, in fact, somehow come or are derived from natural food sources. Something I've always loved. A lot of us in healthcare are taught medications, surgeries as treatment, but there is this growing shift across all forms of healthcare that, hey, no, if we can change our lifestyle, if we can eat better, be more active, sleep better, if we can do these things more kind of from naturally, just lifestyle ways, we can prevent so many diseases from occurring and enhance our lives in so many more ways. And so that's something I myself have always been fascinated with and dedicated to learning more to. But let's dig into diet. Let's dig into diet and supplementation and where the research lies and how this could not only protect the retina in the back of the eye, but even improve vision in some ways. Now, I want to take a moment to talk about the eye vitamin supplement that I personally take, which comes from MacuHealth. Now, of course, all the evidence and education that we're providing here today in today's episode is independent. This is 100% just me doing the research and sharing this information outside of any sponsorship or affiliation. But a lot of people over the years have asked me, hey, what is the most trustworthy brand that I've come across? What do I personally take? What have I found the most success with? And this is why I've decided to collaborate and work with MacuHealth and sharing that brand specifically. I always try to take a step back when I work with a supplement company, or if I'm going to recommend anything publicly. I think, okay, if I was going to start my own company and sell this type of product, how would I do it? Well, I would have to hire some of the best PhDs, researchers in the world. We'd have to constantly change our formula and how we produce these products based on what's the newest research and what the research is showing is the most effective and is like the best quality. And we'd have to have really strong quality control because a lot of supplements, unfortunately, especially ones sold on the internet, are often, they could be counterfeit, they could be faked. We have no idea what's in them. And that takes a lot of manpower. It takes a lot of professionals to make sure and have that level of quality control. And it's hard to do it all on your own. And so thankfully, I found a company like MacuHealth who is dedicated to all of those same values. They do hire some of the best PhDs and researchers in the space of macular carotenoids. They also constantly are changing their formula based on what that research is showing. And they have some of the best quality control in terms of supplementation. And that's one of the reasons why not only myself, but many eye doctors, eye surgeons, and retina specialists trust the brand of MacuHealth and their formulations. Again, all of the information we're presenting in today's episode and across all things I talk about here with the Dr. Health podcast or on the YouTube channel is always independent and focused on education and the evidence first. But if you're curious about what I personally take and are looking for something that I trust, then MacuHealth is a great resource. And right now you can save 20% off all products on MacuHealth's website by using the code AlanSummer at checkout, or simply clicking the link in the show notes. So we're going to first be highlighting that of macular carotenoids. I've talked about this in several videos and other educations that we've done because this probably has the most robust research for not only protecting the retina, but again, having some visual benefits. So if you've never heard of macular carotenoids before, I'll just share that carotenoids, there's over 600 to 700 of these naturally found in nature. They are what make a lot of fruits, vegetables, and plants colorful. So they make your trees look green, also yellow, orange in the fall. They make your root vegetables like carrots look orange or potentially purple and other colors like that. And these carotenoids, of all of them in nature, there are two that go in high quantities and deposit specifically within the eye. And we've evolved with our eyes to have that for a specific reason. The main ones I'm talking about are that of lutein and zeaxanthin. And there's a third one called mesozeaxanthin that your body, in fact, in the retina cells, will take lutein and turn it into mesozeaxanthin. But there's a lot of research now where they've supplemented mesozeaxanthin specifically and found some significant benefits with that. So these are dispersed throughout the retinal tissue and they appear in higher quantities, especially zeaxanthin and mesozeaxanthin, toward the center bullseye in the back of the eye, the part of the eye we call the fovea, which we use to give us not only color vision, but sharp vision in our ability to see fine print and whatever you're looking at in the center of your vision. It is the bullseye, single reticule of what you're looking at. So why this is important is when it deposits in the eye, it acts as a blue light filter. We hear a lot about blue light since especially 2020, but we talk about blue light coming from digital screens, but most blue light comes from the sun. And blue light being really high energy does increase oxidative stress or reactive oxygen species and creates a greater amount of stress on biological tissues. Kind of like UV light, ultraviolet light. It can potentially damage the cellular tissue. Why it's important is that these carotenoids have kind of a yellow-orange color, and so they negate and naturally block some level of blue light within the retinal tissues. So it's your own body's own defense mechanism against harsh light. On top of this, they also have a function as a very powerful antioxidant and a very powerful anti-inflammatory naturally within those tissues. And the retina is the most highly metabolic tissue in the whole body because it's extension of your brain. It's just neural tissue like your brain is, except it is exposed to the outside elements, especially from direct light that is hitting and bombarding, photons are bombarding the retina all day long. As soon as you open the eyes, that light energy is hitting the back of the eye and it's stressing it out and causing oxidative stress. So that's why these antioxidants and anti-inflammatories are believed to be so effective. Now, these carotenoids we get in a lot of our natural foodstuffs. They're found in higher quantities in the darker leafy greens like spinach and kale. I got a list here on screen of collard greens, mustard greens, turnip greens. Some other lutein-rich, lutein-zeaxanthin-rich foods, they don't have as much, but they include broccoli, Brussels sprouts, corn, peas, and squash. And even egg yolk has some. It varies across research from 0.2 to maybe 1.2 milligrams. But they, in fact, supplement chicken feed with carotenoids, with lutein specifically. They, in fact, grow, and there's entire engineering PhDs behind this, of growing corn and chicken feed to be like red corn that has more lutein in it so they can feed the chickens, because it's not only healthy for the chickens in their eyes and in their bodies, but it also helps them produce more orange, kind of yellow-looking egg yolk, which is not only healthy for us, but is visually pleasing to consumers. And they find that people purchase and attribute healthier, better looking eggs to it looking like a dark orange, golden orange yellow color of the egg yolk. I will mention that if you're thinking, hey, I'm just going to try to eat and get lutein naturally with salads and eating more fruits and veggies, which I strongly recommend, a diet is always first. Do know that lutein is lipid soluble. So these carotenoids need some form of fat to digest. So even if you eat spinach and kale, if there's no fat along with it, if you're not eating nuts and seeds or putting a little bit of olive oil on your salad, you're not going to absorb those carotenoids as well. So there is some just truth to be known that if you're eating salads and you're trying to eat more salads to get more lutein zeaxanthin, you need to have some fat component like an avocado or again, some sort of salad dressing like olive oil, or you put on some sort of walnuts or something like that onto your salad. So that's where you can get a lot of green leafy vegetables. You can get a lot of these macular carotenoids naturally from. What's fascinating is when you dive into the research on this, not only do they find it, hey, people who eat more and have higher levels of these carotenoids in their system, do they have these benefits for the eyes? But then they look specifically at, hey, if we can control in these studies and give supplements, do we see the same effect? Can we show that supplementation of these carotenoids improves the blood serum levels? And then do we see a change in the eye? And do we see a change in risk of disease and pathology going forward? So they have found in many studies, and I have like 16 to 20 different studies I'm referencing here, and I have them on screen. And again, you can check in the show notes for these references. But they find that as people have higher levels of these carotenoids, their macular pigment density, or what we call MPOD, macular pigment optical density, improves. Over the course of about 3 to 6 months of supplementation, the macular pigment often improves by about 30% or so. And people who have higher levels of macular pigment in the eye is associated with a lower risk of progression of certain age-related eye conditions, such as macular degeneration. In fact, a lot of lutein, if you look on the back of eye vitamin supplements, they usually have some component of lutein and zeaxanthin and mesozeaxanthin added in. They've also had studies that show it may have protective benefits for diabetic retinopathy and glaucoma, because some of these different carotenoids may have, again, an antioxidant or anti-inflammatory effect. And then they have shown to in general reduce inflammatory cytokines, not only in the eye and in the retina, but in reducing that in the tear film has been shown to help improve tear film stability in some trials. Now, the area of vision improvement, because that's really the big topic about today, is how do we improve eyesight, right? Is that how can we do this naturally? Where they've shown in this research is that it improves contrast sensitivity, especially in low spatial frequencies. And what I mean by that is your ability to detect, again, dark versus light, to detect subtle changes in gray tones. As we have on screen here, this is actually a kind of a mock version of what we call a Pelley-Robson contrast acuity chart. And so toward the bottom of these sort of charts that we have, things get very faded letters. At the top, it's black letters on white background, very like similar to what we do in vision charts in the eye clinic. But at the bottom, it becomes very faded gray, and eventually to a point where it's like hard to tell against a white background. But people who have improved contrast sensitivity, they can see these letters further and further down this vision chart. So even in low light, these individuals often see better. In addition, studies have shown that people who have higher amounts of this, either macular carotenoids, higher macular pigment, they also have reduced glare sensitivity. So this is discomfort that you get from bright lights, right? Whether it be headlights on a car, bright sunlight outside, even if you're someone like me who spends unfortunately a lot of time indoors in front of a computer screen, if sometimes these bright computer screens bother you, yeah, you can turn on the computer screen light a little bit, but maybe that's not enough. This may actually improve some of that kind of glare sensitivity that people experience from electronic screens even. So this is where really it's kind of fascinating that we'd see this improvement. And again, I find a lot of my patients who they're frustrated because they don't feel safe while they're driving at nighttime. And this could be from changes in eye diseases like cataracts or macular degeneration, but we test for that, and a lot of patients who complain, even 20-year-olds who don't have eye disease or pathology, will complain of these challenges driving in low light situations. And so this is oftentimes a great way to talk like, hey, let's change diet, let's consider supplementation. After 3 to 6 months, let's recheck things and see if there's any improvement. And that's what a lot of these studies have shown, that people are having improvements in these subjective findings from taking these types of carotenoids. They also have enhanced photo stress recovery time. So if you do, like for a brief moment, see the sun or a bright light and then turn away, you can kind of see this after effect of that bright light. And so that's called photo stress recovery time. And they find that people have faster visual recovery when they're taking these supplements. And then they have improved visual processing speeds or sharpness, not only in older populations, but in younger populations when they take these forms of supplements. That's all visual enhancements, and that's really the big focus today. But there's so many great things about macular carotenoids that I've presented on before, and I don't want to just leave all of this on the table. So I do want to call out a study that came up from last 2024 that looked at supplementing with the same level of carotenoid supplements, found that in basically lowered pro-inflammatory cytokines like interleukin-1 beta, TNF-alpha, and oxidized low-density lipoproteins, and these are all strongly associated with development of atherosclerosis, which leads to heart attack and stroke. And so now that was such a profound research finding. They're now looking at this for, hey, do macular carotenoids, could this help prevent problems like stroke and heart attack, or could it help with other things that affect like our liver and liver function? But they're also using it for testing in conditions like Alzheimer's and memory disorders, because they're also finding that it helps get into the neural tissue in the brain. It may help with that too. It also has been found to improve sleep quality and mitigate sleep disturbances, as well as help with stress levels. So really fascinating of how this can affect our bodies, especially our eyes and our vision. I do want to highlight this one study who came from Dr. James Stringham. I've actually met Dr. Stringham before and had a great conversation with him, and I hope to have him on the podcast at some point so he can break down some of his research, because he's worked with a lot of high elite athletes in trying to see how can they improve vision for athletes, as well as people who've had head or like concussion injury. But this is one study where they looked specifically at contrast sensitivity and something called lateral inhibition. So this is a 12-month double-masked placebo-controlled trial. They had 59 healthy young adults aged 18 to 25. So these aren't older adults. These aren't people with memory loss or poor vision issues. These are like prime healthy college students, 18 to 25. And they studied them for a year. They had either participants following placebo, so they're just taking like a sugar pill and told, hey, take this and we'll follow your vision and see how things change. Where the other groups, they had take about 12 milligrams a day of these carotenoids, and the other group, they doubled the dosage and they did about 24. It was technically, the 12 milligram was about 10 milligrams of lutein, about another milligram of zeaxanthin, and another 1 milligram of mesozeaxanthin. And then for the double dosage, they just doubled that. So what they did is they manually measured, hey, does there an increase in serum levels and specifically macular pigment changes? So not only do we take the supplement, did it affect the body, but did it go directly to the eye? And they proved yes. As people took more carotenoids, they had increase in their macular pigment. But then they tested their contrast sensitivity, specifically through lateral inhibition sensitivity. And if you're looking at the screen, what I have here is a type of optical illusion called a Hermann grid. It's quite famous in the optical illusion world. So when you look at this, it's a bunch of black squares with some spaces in between, and in between the corners of the squares, most people will be able to see kind of what appears to be like a gray spot, but the gray spot's not actually there. It's your brain and your visual system filling in that gap because of the contrast and spacing between those objects. But next to it, I have all of these squares at a very low contrast, so I made them very faint gray on the white background, and most people probably can't see that same gray spot in between the squares. And this has to do with what's called lateral inhibition, which is a key retinal process that helps your visual system detect edges, borders, and again, contrast. But the big key takeaways they found from this study is that as the MPOD increased in both supplemental groups, contrast sensitivity improved when they took supplementation in both groups. And it wasn't significantly different between the 12 milligram versus the 24 milligram. But that lateral inhibition improved with it. And that was seen not only at 6 months, but also 12 months compared to the people taking placebo. So this study alone, if we just take this as a snapshot, it showed that, hey, taking about a 12 milligrams of macular carotenoids a day at about 6 month time period had a significant improvement in contrast changes in their vision. And I think that's significant, especially for anybody who has problems, driving in dim lights, for anybody who wants to enhance their eyesight and see even a little bit sharper, see things in finer detail. So some real world kind of relevance I want to include in here is that Taking supplementation of carotenoids not only is protective, as we find in many studies, for certain eye conditions like age-related eye diseases like macular degeneration, but also improvement in detecting edges more clearly, reading signs at a distance may be improved, seeing through haze or low contrast environments like driving in fog, and then even reducing visual strain during demanding visual tasks, especially for a lot of people who are sitting in front of a computer screen all day. If you find yourself leaning forward, having to squint to see on the computer screen, then this may have a benefit there. Other key takeaways, just keep in mind, supplementation takes at least 3 months, but most of the studies shift toward closer to 6 months as showing this strong benefit. And many of the studies do show the exact recommended dosage of lutein and zeaxanthin has not been solidified yet. There's no formal agency to kind of give us that stamp that, hey, you need this much a day. But most studies are somewhere between 10 and 20 milligrams of lutein, another area of around 2 to 4 milligrams of zeaxanthin. But hopefully as studies go forward, we'll have even better idea of where this optimal dosage is, but it's somewhere in that range. Now, if you have questions about macular carotenoids, anything like that, that's something I've been fascinated with and always diving into. So if you have questions or again, want to know more, let us know. Either if you're listening on podcasting stations, platforms, leave us a review, drop questions in there. Or if you're watching over on YouTube, drop it in the comments section, because I do try to read and answer as many as I can. And a lot of those questions can oftentimes fuel motivation of being like, okay, this is not only a question we should answer in a future episode, but maybe we can do an entire episode breaking down that question. And we've done a lot of those deep dives in the past. So let's switch over and talk about eye training or vision training programs, because there's a lot of confusion and I think even some misinformation about these programs online. I do not have the time to go over all of what is called vision therapy. That is a very different area, a subspecialty of eye and vision care that does, contrary to some people online, say that there's no research in it. It's like, well, no, there's a lot of research. If you spend the time to dig into PubMed, you can find quite a bit of research on that. But I want to talk about the one that has the most significance for true visual improvement, because forms of, I'll say, eye training exercises like eye muscle, eye exercises, those may help with eye coordination, eye teaming, and the communication between the brain and the eye muscles to be able to fixate and look at different distances. And they help a lot for people after rehab with brain injury, or maybe if somebody has a developmental eye issue where the eyes aren't coordinating correctly. But certain forms of vision therapy are not going to improve your ability to read further down the vision charts. They're not going to change your refractive error in any way. But there is a visual training program that is getting evidence in published research and is getting a lot of interest, even winning awards at major eye conventions. And so I want to at least highlight this technology, and because I've been testing it out myself, and I think it's just fascinating, and I think we need to give a little bit more air to where the science really is. So what I'm talking about is perceptual learning. So this isn't training the eyes to be a different power or function better. It's training your brain and the cognitive areas around your brain that help us perceive vision. So this is training-induced cortical plasticity. This is using specifically a type of technology called Gabor patches. And thank you and shout out to anybody who saw my previous YouTube video where I talked about this a little bit and corrected me. I was calling it Gabor patches, and I guess I was pronouncing it wrong. It's called Gabor patches, which is a technology that even helped win a Nobel Prize, I think back in the 1950s, if I'm correct. But this Gabor patch technology, they look like what I'm showing on screen. They're basically these gratings of black and white lines at different contrasting levels and oriented at different directions. And based on where they're placed on a screen or what you see, even though they may not mean anything visual to us, it's not like reading letters, they stimulate the brain in certain ways. And they stimulate the visual cortical cells to refine and notice sharper, subtle differences in contrast and shapes. And so this is being used in special training programs that kind of look like this. You basically sit at home on a computer screen, you sit in kind of a darker room, and they have you go through a couple of different kind of vision or eye training exercises where you recognize, hey, if we flash this kind of image on screen, are you able to detect where these fine lines, these Gabor patches are? If you're able to see and detect them, then the system will correct itself and then make it more challenging. They essentially make these patches more and more faint over time to the point where you can barely discern and tell that there's something there. And then as you go through the training program, again, they not only change the orientation and the location, but they make it more and more difficult. And they find exactly where you're at, and then they kind of push your brain a little bit more, this cortical plasticity, so that your brain's able to kind of wake up and recognize where these certain grid lines sort of appear and not. And as they've done this for not just general population, they've been doing it for specific eye conditions like infantile nystagmus, amblyopia or lazy eye, keratoconus, Stargardt's disease, people with low myopia, so people who have just like anywhere from a -1/4 to like a -1 of nearsightedness, people with presbyopia, having a harder time seeing up close, and even for people for post-LASIK and post-cataract surgery. And on average, people who go through this program can see across a couple different studies, they've shown that it's improved by about 2 lines of improvement on the vision chart, which again, I think most eye doctors, if you're listening in, are kind of like, wow, this is something that wasn't covered in school. Maybe you remember the Gabor patches from vision science classes, but now the fact that we have evidence that there's some people who, even with glasses and contacts, the best glasses and contact lenses, they still struggle to see the fine letters. Going through this cognitive training program, they can start to read further down the vision chart. That's, again, really, I think, inspiring. One study, it was a publication by a PhD, MD PhD, and won an award in 2025 for Best Scientific Paper at ASCRS. That's the American School and College of Refractive Surgery. They submitted this study, and I think it's quite meaningful for me as a practitioner, but also I think, again, gives some testament to where this research is at. So this was a prospective, controlled, randomized, open label study. So they had 30 adults who were older, age 50 to 80, and they had multifocal IOL implants. It was uneventful, so there's no complication from the surgery. So they went through a multifocal implant. You've never seen a multifocal implant. I have a picture of one on screen from a patient of mine. These implants, they have all these rings on them, these concentric segmented rings, and they help improve people's ability to focus far away, but also up close and intermediate distance. But the downside is contrast acuity is usually decreased, and people will see glare, kind of halo artifacts. And so some people who are very sensitive to glare and halos, they'll have the procedure and they'll be really unhappy. A lot of people are very happy and they're just like loving the fact they don't have to rely on like reading glasses very often after the surgery. But a lot of people are frustrated with it, especially with some designs. And so they recruited about 30 adults here who are unhappy. Their vision was about 20/40 and had suboptimal contrast sensitivity. So they did 40 training sessions and followed them not only during the therapy sessions, but then post-therapy about 6 months. And they found that the average improvement in this group had 2.5 lines improved in a Logmar treatment arm, which again, seeing about 2.5 lines of improvement on average for a group that was just really frustrated with their vision, that makes a big difference in their ability to function throughout the day. In addition to this, they had an 83% improvement in contrast sensitivity. And this is all not changes to the eye. Again, this is cognitive changes to the brain that improved their perceptual ability. I think, again, this is just fascinating and some testament to how the vision and how we see is more than just refraction. It's more than just glasses and contacts. It's more than just the health of the eye. It has to do with the stability of the tear film. It has to do with the retina in the back of the eye and how that functions, but then also how our brain interprets of what we see, interprets the world and how we see it. And so hopefully with today's education, you got some better insights into where research and where evidence truly is and how we can improve our eyesight and vision. If you have questions about anything we talked about today, again, drop them in the comments section. All references, I think I've called that a few times, are in the show notes. But as always, don't just take my word for it. If you have questions about any of these programs, supplements, red light therapies, or using some sort of vision training program, like using these Gabor patches, then certainly talk to your local eye doctor, be seen, get a proper diagnosis and proper recommendation based on all of your health circumstances. From here, let me just call out that if you're new to the Dr. Alth podcast, to the Dr. Alth YouTube channel, then please do us a favor and subscribe and follow. It's not only free, but it does help us out in the algorithm, help us with our mission in reaching more people to help them with their eyes, their vision, and overall well-being. From here again, Dr. Allen, keep an eye on it, and we'll see you in the next episode.
You've been listening to the Dr. Eye Health Podcast with Dr. Joseph Allen. For more resources, trusted information, and helpful tools, visit dreyehealth.com. Thanks for joining the community that's focused on healthier eyes and a healthier life. Until next time, stay informed and keep your vision sharp.